Hi, my name is Agnes. I am physical therapist, but also I am the rehab director at SLC. So physical therapy is a form of rehabilitation which includes a variety of exercises, different treatments, different approaches to make sure that you as our patient, you will get better, you will get stronger, and we can help you to get to your prior level of function.
My name is Julie Miller. I am a physical therapist here at LECOM Nursing and Rehab, and I am also the rehab manager here. We essentially assess all the patients coming in and out of the building, whether they are rehab patients or patients that are staying here long term. And we want to help them establish the goals for either returning home or becoming as independent as possible, staying here in this facility and just giving them the best care that we can while they're here.
My name is Shelly Mays. I'm the Director of Therapy here at the LECOM Village Square. I'm also the active and primary occupational therapist treating patients here at LECOM at Village Square. Our therapy department here at LECOM Village Square is made up of occupational therapy, physical therapy, and speech pathologists.
Gina, and I'm an occupational therapist. So as occupational therapists in the geriatric population, we tend to focus on the activities of daily living. Can they get up? Can they get dressed? Do toileting? We also, in addition to focusing on strength and balance, we also address areas of positioning and fall prevention, their endurance, with the optimal goal of them performing at their highest level.
Tina Slaney, and I am the speech language pathologist here at LECOM Senior Living Center. So specifically for speech therapy, it is a misnomer and people are confused because they'll say to me, I can talk. But what I do particularly in this facility, the majority of my caseload is cognitive therapy. We work with people who are having some cognitive difficulties regardless of the diagnosis or whatever reason they came medically. I work on the thought processing and sequencing. I work on memory, I work on problem solving.
Goals are established by each therapist when they evaluate the patient. So when I evaluate somebody in physical therapy, I'm looking at their goals for either returning home or staying here.
The main goal of physical therapy is to make sure that while you're here, while you're at SLC, you will gain your strength, you will gain your endurance, you will gain ability to walk again.
Goals of the therapy department and rehabilitation are very individualized. And what I mean by saying that is we kind of make our goals more pertinent to pertain to the needs of the patients.
We're in constant collaboration with the interdisciplinary team here at the SLC. We are constantly communicating with nursing, social workers, any staff member that is involved in the patient's care.
So I believe the collaboration not only within our departments but also with different departments throughout the facility is very important thing. If we're talking about just within the our therapy department, we communicate on a daily basis. We discuss patient progress on the daily basis. We talk about different ideas, how to make it better progress, how to help them improve even faster. So the collaboration within the rehab department happens on the daily basis. And also on the daily basis, the collaboration happens between different departments, meaning social services, admission department, maintenance department, dietary, all of the departments. It's a very important part of patients' stay here, of patients' care, to make sure to ensure that we can offer the best quality of care.
If there's somebody that's brand new that comes in, if their goal is to return home, then we work very vigorously to help them to become more independent. If there's somebody that needs to stay long term, then there's a restorative nursing program that they will follow through. They help with the walking. Some patients come down here and work the therapy equipment. during the day. Activities becomes very involved with them just to keep them busy throughout the day and throughout the year.
We're anticipating the arrival of our residents and we're really excited that they're coming. So we try to make sure the room is ready, and we actually go what's called a welcome conference. That's where an occupational, a physical, and or a speech pathologist might come and meet you. And we explain what your therapy schedule will look like.
I do like my job. Generally, you'll find therapists are very passionate about what they do. We're a very professional group, and everybody that's here is here because they want to help the patients get better.
I love my job. It is very rewarding to see a patient come into our facility who requires a lot of assistance, and then a few weeks later, they walk out of here independently back to their family or to their home.
I love my job. If you ask me that I would do it again, absolutely, I would do it again. The reason why the best day is always when you have patient who is going home and you can see, beautiful smile on their faces and happiness in their eyes.
I love my job. I have been doing this for a long time. Every day is different. A lot of the therapy procedures are the same, but every day I walk in here and there's a new patient that might come in. Different personalities, just different challenges. I've grown to love my patients. I've become very protective of them.
So my occupational therapy job has been very fulfilling. I've done it for 32 years. I love being an occupational therapist. I love treating patients. I think the greatest reward for me as an occupational therapist is actually the reward you get to see as the patient progresses from the moment they arrive to when they leave. It's not the gratitude, it's not the glory. I think it's a personal satisfaction to see someone that maybe couldn't move a right arm be able to grasp a cup.
Our rehab department has 10 clinicians. We have 1 speech, we have 3 PTs, we have 2 PTAs, we have 2 OTs, and then 2 CODAs. I did the math. Collectively, we offer 200 years of experience in the rehab field, which means quality, which means care, which means understanding, which means proper approach to each single patient, and at the end means, success.